Okay, so in this video, we'll be discussing about mastalgia. Mastalgia could be of cyclical or non-cyclical. Cyclical one basically starts on 14th day and it goes on from 14th to 28th day. And non-cyclical one could start at any time during the menstrual cycle or even with on the days when there are no menses. The treatment for that would be initially you could give topical NSAID, Primazole could be given, tamoxifen or danazole could also be given, and reassurance is given in case if there's no lump, that there's no malignancy associated with it. So for the breast cyst, what we're going to be discussing about breast cysts is that it actually arises between the ages of 35 to 55 years. And these present as painless lumps. There are different types of cysts. Two of the important ones are going to be the complex and complicated. So the complex and complicated ones are actually, the complex one actually has a solid component in the cyst wall. Whereas in the complicated one, what happens is that there is going to be intracystic floating debris. So there's going to be intracystic floating debris within the cyst, which is going to move within the cyst as there's going to be change in the position. For example, this is the debris that's present. With the change in the posture, the debris would move here or could move here. So this is going to be a complicated cyst. For the treatment purposes, it's also going to be, for example, a small collection of cysts, maybe aspiration. So the main treatment is going to be aspiration for them. Then we're going to be discussing galactocele. So for galactocele, what happens is that there's going to be subareolar milk-filled cyst. So beneath areolar region, there's going to be a cyst which is going to have milk in it. It could be during the phase of lactation or could be just after lactation as well, and it is cured by just single aspiration. And lactating mothers are actually encouraged to continue breastfeeding. We're going to be talking about now about two benign conditions, which are benign tumors of breast. That is going to be fibroadenoma, and one is going to be the phyllodes tumor. So for fibroadenoma, it is actually called as the breast mouse as well. It is a benign tumor that occurs due to an exaggerated response of lobules and the stroma of the breast for the normal hormone stimulus. And the ages are very important. It is going to be between the 15 and 25 years of age. The lesion is going to be around 2 to 3 centimeters. And it is confirmed on ultrasonography, whereas phyllodes tumor is present above the age of 30 years. First of all, we're going to be discussing about fibroadenoma. So it is also known as the breast mouse. Why is it called breast mouse? Because it is very firm, rubbery, and mobile lump. Okay, so this is referred as breast mouse. The regression of fibroadenoma can be done by using anti-estrogens for it. So anti-estrogens can be used for regression of fibroadenoma. Alongside with that, what can be done is that surgical excision. Surgical excision can be done when the age is above 30. Alongside with that, there's going to be suspicion of malignancy. Third is that it is going to be more than 5 centimeter in size. This family history of breast cancer. And the last one is going to be because of the patient's preference. So for fibroadenoma, we just mainly give anti-estrogen medication, which is going to be tamoxifen. If not, then surgical excision is only done if the fibroadenoma is in a woman of more than 30 years age. There's suspicion of malignancy, which could have been proven on histology. This patient preference is the size of the fibroadenoma would be more than 5 centimeters, and there's family history of the breast carcinoma. For phyllodes tumor, it is going to be above the age of 30 years. It is also called as cystosarcoma phyllodes. So it was called as cystosarcoma phyllodes. The overlying skin of the appearance is very lobulated and it's a very aggressive tumor. It is going to have both mesenchymal and the stromal component. mesenchymal and epithelial component, just like fibroadenoma, but the stromal component would have overgrown. Because of that, there's going to be microscopically leaf-like shape. Alongside with that, the overlying skin would present with ulceration. Why is that so? Because of the pressure necrosis. Okay, so the treatment for phylloids is mainly the surgical excision, and that has to be done, but mastectomy may be needed in case of massive and recurrent malignant carcinoma. So it could be, the first is going to be the excision, and the second one is going to be mastectomy if it is what? Recurrent in nature, and it is going to be malignant and massive. So that's it for the video.